Welcome to Lesson 3. In the previous lesson, we talked about the types of diabetes and their causes. In this lesson, we will focus on type 2 diabetes. Type 2 diabetes is a continuous and gradual process. First, the body produces very high insulin levels. Next, insulin stops working, and then insulin production gradually decreases till the body is unable to produce enough for survival. The period between when a patient has too much insulin and when insulin stops working is called prediabetes. A person with prediabetes has blood glucose levels above the normal range, but not high enough to say the person has diabetes. Once insulin stops working, blood glucose levels rise above the normal range and the person officially has type 2 diabetes. This is not an infectious disease. It is caused by genes and lifestyle, so it cannot be transmitted from person to person. However, we inherit genes which make us more or less likely to get diabetes. The problems with insulin which lead to diabetes happen gradually. And for most patients, the changes begin from between 6 to 10 years before the symptoms appear and a diagnosis is made. Blood glucose is transported all over the body in the bloodstream, so high blood glucose affects and causes symptoms in almost all organs of the body. Early symptoms. First, one of the early symptoms of diabetes is increased thirst. This happens because the body must get rid of the excess glucose in the bloodstream, and it does this through urine. People with diabetes pee frequently and in large quantities. Tiredness. A second early symptom is tiredness. When glucose can't get into the cells, they have no source of energy. So patients with diabetes feel tired often. Hunger. Hunger is another common symptom of diabetes. With little or no glucose getting into the cells, energy levels are low. The brain sends signals to the stomach so that the person feels hungry. If all was normal, once the person eats, the body would get its supply of glucose. This doesn't happen because eating only increases the blood glucose levels. Weight loss. As the body is unable to use the glucose for energy, it falls back on the fat stores that have been produced for periods of scarcity and starvation. This continues over time as the disease progresses. When the fat stores are depleted, the body begins to break down other things, like muscles, in a bid to get energy. Tingling hands and feet. High blood glucose levels affect nerves in the hands and feet. When this happens, patients have a tingling sensation in their hands and feet, commonly described as pins and needles, or feeling like there's no blood moving in the affected part. Skin infections. When blood glucose can no longer enter cells and the body needs to get energy from other sources, certain hormones become active. These hormones which allow the breaking down of the fat and protein. Another effect of these hormones is that they decrease immunity, leaving the patient more susceptible to infections. This is what causes frequent skin infections in patients with diabetes. Decreased libido. High blood glucose levels affect the nerve cells and blood vessels in the reproductive system, adversely affecting their sex drive. Miscarriages. Women with diabetes have a higher rate of miscarriage, as the inability of the body to utilize the food for energy affects the woman's ability to reproduce or successfully carry a pregnancy. Late symptoms. These all occur in the later stages. Blindness. High blood glucose levels lead to blindness by damaging vessels and structures in the eye. Impotence and infertility. Decreased libido ultimately evolves into impotence and infertility. Bloating and vomiting. When nerve cells controlling the digestive system are affected, food is slowed down and doesn't pass through the digestive system at the normal rate. The stagnated food begins to ferment, producing gas, which makes the patient uncomfortable. This is followed by bloating, vomiting, and passage of excess gas. This is a very distressing state for the patient and is difficult to treat. Excessive sweating. When the nerve cells that control the sweat glands are affected, the patient begins to sweat profusely and uncontrollably. This is also distressing and difficult to treat. Hypertension. Most diabetic patients become hypertensive, part of the effects of the other hormones kicking in to break down fat and protein to produce energy is an increase in blood pressure resulting in hypertension. Dizziness on standing. In a healthy individual, when you stand, your blood pressure rises a little as a compensatory mechanism by the body. This is lost in diabetic patients, causing them to feel dizzy when they try to stand. Diabetic foot. Damage to the blood vessels and the nerves in the feet cause two problems. First, patients don't feel pain when they have an injury. Second, damaged blood vessels reduce blood supply to the feet. Immunity is reduced because of the hormones which promote breakdown of fats and proteins for energy. So, any foot injury is not felt and once affected, quickly spreads, causing permanent damage to the foot or leg. Stroke. There is an increased tendency for clots to form in the blood because of damage to the blood vessels. When these clots form in the brain, it leads to stroke. Kidney failure. This is related to hypertension in diabetic patients. High blood pressure gradually damages the kidneys. It's a very difficult and expensive condition to manage. Patients require 3 dialysis sessions a week once the kidneys fail. Causes of death. Conditions like these lead to an earlier death in diabetics as opposed to the average person. For example, Grammy Award-winning musician Luther Vandross was diabetic, hypertensive, and obese. He had a stroke in April 2003 and was unconscious for 2 months. And finally died of a heart attack in July 2005 despite having the financial resources for the best healthcare. Dementia is another cause of death for people suffering from diabetes. Dementia is an abnormality of decision-making, behavior, and thought processes. It usually affects the elderly and is caused by damage to brain cells. In contrast to stroke, which affects a large part of the brain, dementia is caused by gradual loss of tiny parts of the brain over time due to changes in blood vessels and nerves. Symptoms include confusion, mood swings, apathy, short attention span, and memory loss. Memory loss is by far the most important symptom, but because memory of distant happenings is retained, it's not obvious that there's a problem until they can't cope with simple tasks like adding figures, following a conversation for a long period, or realizing people are being dishonest. Impaired thought processes mean they may be able to tell if they are ill. This, coupled with diabetes and high blood glucose, makes them prone to infections, which spread faster and are more difficult to treat. Famous people who have died from dementia are Robin Williams, Rosa Parks, and Margaret Thatcher. Another cause of death is a heart attack. It is caused by abnormal blood supply to the heart and is common in people with poorly controlled hypertension and diabetes. Patients typically complain of chest pain, and the bad thing with people with diabetes is that they have no pain during heart attacks. They have no clue, unlike people who do not have diabetes. Famous people who died of a heart attack are Cum-Laude Dumour, Miriam Makeba, and Louis Armstrong. Diabetic foot, as we said, occurs when a patient gets an injury, usually on the sole of the foot. The wound gets infected, and because they don't feel pain, they are not aware. The infection spreads from the foot up the leg and damages blood vessels as it goes. Gradually, blood supply is totally lost, and at this stage, it is called gangrene. Once gangrene sets in, the affected leg, foot, or toe has to be amputated. A lot of the time, depression or the psychological trauma associated with having to have their legs cut off is part of what makes diabetics with diabetic foot die early. It's a bad complication to have. Most diabetics are prone to infection. Their infections spread faster and are infections more difficult to treat. Stroke is another cause of death. Here, blood vessels in the brain become blocked or rupture, leading to bleeding. In both instances, blood supply to the brain is affected. Kidney failure is another cause of death we talked about earlier. Heart failure could result if a patient has a mild heart attack or from long-standing hypertension. With heart attacks, part of the heart muscle dies from decreased blood supply, whilst with hypertension, the heart becomes overworked, just the way the pancreas becomes overworked and can no longer function. Hypoglycemia is when the blood glucose levels become so high the patient becomes unconscious. It's an emergency, and if not treated immediately, could lead to death. Another thing that could lead to death instantly is hypoglycemia, and this is when the blood glucose levels fall below normal. The brain cannot survive without glucose. Once this happens, the patient is also in danger. It's also an emergency and can occur from problems with insulin or the drugs that are used to treat diabetes, because these too lower blood sugar. Diabetes does not have to be a death sentence. It can be controlled. There are many people who are alive and thriving with diabetes. This is the end of Module 1. In this module, we've learnt about food and blood sugar, how problems with insulin cause different types of diabetes, and what happens when a person has type 2 diabetes. The most important message is that diabetes can be beaten. If others can do it, you can too. We look forward to seeing you in the next lesson, where we'll learn about controlling blood sugar.